There are certain values that we have as an organization, so some of that is sort of gated at the front end on who we recruit and hire into the organization. But there are also daily touch points, weekly touch points. One of the biggest touch points is the clinical supervision model that we use. Transparency is a value that we have, not only to talk about X, Y, or Z case, which sort of distances providers from patients, us versus them. That can happen in organizations too, administration versus clinical, or business executive versus like line workers. But in our clinical supervisions, we're talking about our own work, how that's reflected in our work with patients, our interactions with other staff, our interactions with authority figures within the organization. When an authority figure does something that's out of line with our values, that's something that we address immediately, and that's an ongoing process. It's sort of how we live. And some of those principles come from the 12 steps, some of those principles come from organizational psychology, but we really do try to practice what we preach here. If I'm not willing to show up on time and come to work and be here on time, start group on time, end group on time, how can I expect any of our patients here to do that? We're not going to ask a patient to come here and do stuff that we're not willing to do. We're going to ask patients to come here and do hard work. We're going to be shoulder to shoulder with them in doing the work, and we're going to be doing our work as an organization too. And that's work that needs time and space to account for it and support it. Otherwise, it's just a nice theory and paper.